This video will demonstrate how to perform a mid-lower face treatment using the small facial applicator. The mid-lower face consists of the area between the malar region or cheekbone, extending to the mandible or jawline. It also includes the submentum, also known as the chin strap. Before performing a mid-lower face treatment, it is important to mark the treatment areas using vectors. This will allow you to organize your treatment so that you are spending more time in the areas of greater laxity. While your patient is sitting, mark the first vector, which we call the Nike swoosh. Using your thumb, locate the malar fat pad or cheekbone. Place the heel of your hand over this area and gently pull the skin up. Take your skin pen and make a dotted line from the side of the nose to the tragus. Your line should look similar to an elongated Nike swoosh. Next, locate the mandible, and using your skin pen, make a dotted line right on the bone from the chin to the tip of the earlobe. For the submentum, mark 2 finger breadths below the jawline. Position your patient comfortably and apply a generous amount of ultrasound gel from the cheekbone to the jawline. Begin treating from the cheekbone to the jawline using the maximum treatment settings. Your patient should feel intense heat, but not pain. Instruct your patient to say stop before the sensation of pain is felt. When the patient says stop, reposition the gel. Often, during the short pause in the treatment, the skin cools enough so that the patient can comfortably continue at the starting power settings. If the patient says stop again, then decrease the duty factor. You will treat from the cheek to the jawbone using very slow, sweeping motions. After the area is warmed, you will then focus on the vectors. It will be necessary to reposition the gel throughout the treatment. Remember to use gentle downward pressure and to maintain the applicator tip perpendicular to the treatment area to ensure proper contact of tip to tissue. Before treating the first vector, using a tongue blade, move the gel from the cheekbone area down to the first vector. You may apply additional gel if necessary. While using the heel of your gloved hand, pull the skin up, and then treat using very slow sweeping motions. You will want to treat in 2 rows, as this will allow the skin to relax before the next pass. Once you've completed the first vector, you will now move the warmed gel down to the second vector. Using the heel of your gloved hand, pull the skin up and off the jawbone. Be sure to treat using 2 rows to avoid excessive heating of the tissue over the bone. Now move the gel to the chin strap area. It may be necessary to apply additional gel. You will start treating at the lateral aspect of the neck and move the applicator towards and past midline. Be sure to use slow sweeping motions as well as adequate pressure. You must always consult the treatment settings guide for appropriate treatment parameters.